Today I'm going to share with you one of my very close to my heart case studies and stories about this little Japanese boy. His name is Yuta. Okay, these names have been changed to protect the identity. So Yuta was 9 years old. He was playing in a playground. He fell, like most of the kids do at the play. He fell, unfortunately, broke his elbow, and he had surgery. And then two things went wrong. Firstly, his family waited before they started therapy, before they started rehab, right? They were busy, but more importantly, they were scared because when there's a fall and there's something break in the elbow, when there's surgery, there's lots of pain, lots of swelling and bleeding, right? So they waited for the pain to settle, for the pain to drop, and it felt okay to wait, or maybe they didn't know. Secondly, when they finally started doing elbow therapy, they went to see a general physio, right? Like general physio to do physiotherapy for the elbow. This is not because they made a bad decision, but it's also because they didn't know there's a difference in timing, and there's a difference seeing a physiotherapist versus a hand or upper limb therapist for elbow therapy, especially post-surgery, right? So by the time Yuta walked into Phoenix Rehab, right, it's been 4 months after his surgery. His elbow, when he straightened it, he couldn't go straight like this. This 180 degree, it is flat, right? 180. He was bent 20 degrees. Okay, you call it 0 or you call it 480 degrees, whichever you want. Let's call it 0, but his was bent 20 degrees. So this was his first small problem. He had a big problem. Yuta, I miss you so much. The big problem is that he could only bend his elbow up to 80 degrees. So if this is 90 degrees, so 80 degrees like this. 80 degrees, imagine. You can't even touch your own face. 80 degrees, you can't touch your face. You can't. He can't touch the back of his head. He can't wear his shirt. He can't use his hand to play. He can't use his hand to do many things. He can't go toileting independently. It's just blocked like this, and he can't do anything with it, right? It's not enough to be a normal 9-year-old boy. I mean, don't say 9-year-old boy lah. Anybody who have an elbow that can't bend more than 80 degrees, you can't. Whatever age you are, you'll be quite limited in your lifestyle, in whatever you want to do. So his parents were worried. They were exhausted, and they were running out of time because they were relocating. They were going back to their own country. Okay, and insurance was ending, and we had exactly 2 months. And I want to be honest with you, with myself as well, about how hard this was. You see, he and I don't even speak the same language, you know? Totally different language. He was 9 years old, he was in pain, he was scared, and he rather play, to be honest. I mean, at 9 years old, I was playing too, right? And it's far from home. So one of the things that I usually do for very stiff joints is paraffin wax bath. It's quite a warm treatment, actually pretty warm, and it's really good because the heat goes deep into the joints. But I am not comfortable giving it to him because it was like too hot for him and it may burn him, and if it gets burnt, that would delay or set back the elbow therapy even more. So we have to adapt, right? So we work with heat modalities that he could tolerate, right? So do a lot of joint mobilization that's very intensive. Within his pain tolerance, we have to work with his soft tissues around the joints, right? And there's lots of graded range stretching. You know, you got to be careful. I cannot go too hard, cannot go too fast, cannot go too slow because we have limited time. And we have to do it session by session and to push it. And sometimes I try to get them come back twice a week. Even that was tough because he goes to school, right? And he has his own school life, his own activities. So we had to work within his pain, within his age. And sometimes he just didn't feel like it because he's a 9-year-old boy. I mean, I have to turn on some shows for him to watch to distract him a little bit, right? And I remember trying to look through because he's from Japan. So I looked through for Doraemon. I looked through for cartoons that is appropriate to his age, that he'll be at least have some interest or at least distract him for a while. So I have to work with his age, work with his schedule as a student. I have to work within the time and the time frame that we had. So fast forward, 2 months later, okay, so Yuta could finally touch the back of his head. I'm so happy, I want to cry. Even thinking back, I'm so happy. He could reach and touch the opposite cheek, right? He could touch his shoulder, briefly touch his shoulder on his own side, right? Still not perfect, still not the same like the other side. The other side, it will be, for full elbow flexion, you can go 130, 140 degrees. Here, it's just closer towards maybe 110, 105. So, but going from 80 to 105, it's not a small thing, it's a significant thing. It's even not be for adult or for child, it's significant. For a child with post-surgical stiff elbow at post-op 4 months, it's significant, clinically, be honest lah. His mom cried, I teared up. I mean, right now my second kid, right, is 9 years old. So I think it's getting really close to my heart. I feel it a lot more. And on this last day, I'll send a photo for you later. On the last day, Yuta handed me something that I'll never forget. He did a drawing for me, right? I think I'll put it here later. He did a drawing for me himself using both hands, and in the picture, there is hearts, there's a sun, there's a star, and a note in his careful handwriting. He said this: "Thank you for every time. You are very kind and I love you." And he signed it off. But of course, I have to hide the name from you guys to protect his identity. And these are the things that makes me so soft in my heart and reminds me why I really love being a clinician and why I help my clinicians to take care of other patients as well, right? So I really want to share this with you because this is one of my favorite all-time, straight to my heart, kind of like a testimonial from my patient, right? So those two mistakes, right, not just cost him 4 months, but it also cost him full recovery as well, because post-surgery, you should come for therapy on day 1 or day 2. Don't wait until the pain settles down. 4 months into waiting, the scar tissue will harden. The joints will stiffen. If the window for recovery, for fast and rapid recovery, narrows very quickly, the longer it is after your surgery. So a general physio is trained for many things. They do a lot of things. They got neck to do, they got back to do, they got knee and hip and ankle. But post-surgery elbow rehab, be it in the child, be it adult, the joint mechanics, the considerations, the specific mobilization techniques, the know-how, these are not the same between a physio who does almost everything versus a hand occupational therapist or hand therapist who specializes in fingers, wrists, forearm, elbow, and the shoulder, right? We recovered significant function for Yuta. But the truth of the matter is, if he had come from day 1, if he had come to the right person from day 1, I would dare say that his recovery would have been significantly better, maybe north of 90, 95, maybe even 99% recovery, rather than, barely touching the shoulder. Although going from 80 degrees, which is like this, to touching here is very significant. But for me in Phoenix Rehab, when I lead Phoenix Rehab, when I be a clinician in Phoenix Rehab, I always aim, our goal is always 100% recovery, where possible, where humanly possible, right? 100% recovery is the way to go. Anything below 100% is subpar, unless there's no choice. So we always push for 100%. This is not a criticism of the family, this is not a criticism of physios, it's just what happened. They were wanting, they was delayed because of because of pain, because of schedule, because of fear, because they don't know. Whatever it is, this is the reason why I'm sharing this, right? So if you know someone who had elbow surgery or any upper limb surgery or any surgery on any parts of their bodies or their joints, right? Please do not wait for pain to settle down, or don't let pain be the guide. Pain should not be the main guide. Pain is an indicator there was an injury, it's repairing. but it's not the same as healing. It's not the same as recovery. You got to glide the soft tissue. You got to get the joints to move so that you can move normally. I always share this with my patients last time. Our bodies are organic. You can't just sit down, wait for the pain to go away, and then you just jump up after 6 weeks and then ta-da, you're fine. No, it's not like that. You actually got to really glide your joints, glide your muscles, glide your tendons through the full range of motion. Like in Yuta's case, we got to get aiming to be straight in the elbow here and be able to touch all the way down, exactly like the other elbow. So that's the reference point, right? So if you have any questions, if you're going to go for elbow surgery soon or any surgery and you're not sure about therapy or hand therapy, drop me a text, drop me a call, and we'll be more than happy to go through the steps with you, to advise you, guide you what you can do before, during, and after your surgery, and how fast you can start your therapy with us. So start your therapy early, see a specialist, not a generalist. So WhatsApp me or